Global health concerns the health of populations throughout the world. Organizations like the Center for Disease Control, the CDC, work rigorously to prevent and control disease threats in communities across the globe. The CDC works to fight various types of health threats for many communicable diseases, such as malaria, HIV, tuberculosis, and many more. However, the CDC fails to recognize the issues of mental health that plague societies.
In this image, you see a scientist working on an influenza vaccine. In the next image, you see a scientist working on an Ebola vaccine. Both of these diseases have a direct visible impact on communities, but what about the diseases that infect society in an indirect, invisible way? Why are these issues left unaddressed by researchers? Complications of mental illnesses affect societies just as strongly as other communicable diseases.
Mental health affects people all around the world, regardless of demographic, race, wealth, gender, and ethnicity. Even the most developed nations have staggering statistics on rates of suicide, drug addiction, violence, and self-harm, all connecting to mental illness. Some of the most underdeveloped nations in Africa and Asia have very low rates of mental illness.
Looking at this image, you can see how nations like the United States, Canada, and Europe are in a vibrant orange color, signifying the relatively high percentage of populations with mental health disorders. Why would something like this be? In theory, the more developed nations should have better access to medications, doctors, and knowledge about mental illness/health, and therefore there should be a better battling mental illness, and in turn have a lower percentage of people with mental illnesses. However, underdeveloped nations blow developed nations out of the water when it comes to issues with mental health disorders.
The difference is likely due to the difference between individualist and collectivist communities in different countries. Individualism emphasizes the one's focus on his or her individual self and doing things toward his or her own ambition. In contrast, collectivism focuses on the whole and the collaboration of a community to solve a common issue or reach a common goal. Emile Durkheim proposed an idea on the effects of individualism and collectivism on suicide. He found that countries that had previously faced oppression by other groups actually had lower rates of suicide.
The brutality and oppression underdeveloped nations faced by the Europeans for many centuries contributed indirectly to their lower rates of mental illness. European dominance has led the building of strong, tight-knit communities with these nations. These communities were found during times of European oppression and have a strong emphasis on a sort of support system. This picture is just one example of the torment Africans and other citizens have faced when Europe occupied their countries.
African civilians gained fundamental relationships and community that has been essential to both their physical and mental survival. The civilians in the 13th and 14th century banded together and made communities based off of collectivist ideals. The formation of these groups allowed their descendants to have better mental health and community relationships. As you can see in this picture, this collectivist community is coming together for a social event while supporting one another.
When we look at the European side of history, we see the unhealthy desire for wealth and power. When looking at this political cartoon, we see the growing hunger to have all the power and wealth in the world. This mentality of individualism led to the increase in prevalence of mental illness in Europe and the United States. The Europeans desired the unattainable, complete wealth and power. In contrast, the oppressed, underdeveloped nations chased after something they could easily attain: community and support.
Now let's take a look at a map of collectivism and individualism. And let's also bring back the world map of mental health disorders. The relationship between individualism and mental health disorders is apparent and cannot be denied.
Where has our mental health system in the world failed? How can we solve the growing issue?
Race is one of the most prevalent factors affecting the rate in which people are detained and also the ability to receive treatment for mental disorders. For Black people, 56.9% of patients were detained in a mental health facility as opposed to 37.5% for white people. The reason for this gap is because of the difference between median net income of Black families opposed to white families. As you can see from this graph, the difference between the wealth of a white person and the wealth of a person of color differs by $583,000.
On average, the lowest amount someone will have to pay for mental health treatment is $3,400. More African American families cannot afford the minimum amount of $3,400 and do not receive the treatment they need. Without the help they need, these people may be detained and receive court-ordered help that these families will will still have to pay for.
The stigma surrounding mental illness makes living with the illness even harder. The stigmatization alone can exacerbate the problems these people already face. According to the Mental Health Foundation, a charity for helping those dealing with mental illness in the UK, people with mental health disorders have claimed that the social stigma attached to mental ill health and the discrimination they experience can make their difficulties worse and make it harder to recover. In our society, there are so many complaints about the cost of incorporate mental health care, yet we are failing as a society to provide basic support to end the stigmatization and better educate others on the realities of mental illness.
The evidence for mental illness is very evident all around the world. According to the World Health Organization, 300 million people in the world have depression, 60 million people have bipolar disorder, 23 million have schizophrenia, and 50 million have dementia.
Seeing all these numbers, we know that there is indeed a problem, but what can we do about it? The main treatments used are medications, therapy, and other forms of psychological support.
Now you may ask, what can we do to fix these problems? We propose that we institute affordable mental health facilities throughout the world. These facilities would offer therapy, counseling, inpatient care, and medications, as well as provide a welcoming and inclusive environment to provide patients with proper treatment and resources. In this setting, each patient would have the right to privacy and confidentiality. The World Health Organization, for example, conducted a study that showed that it could cost as little as 20 cents per person per year to scale up a package of essential interventions for some mental health disorders.
As much as we strive for a solution to mental illness, we as a society need to realize that this is a problem bigger than us. As we progress and change things on a global scale, we have to also work towards making advancements in our own communities. The first step should be to talk about the subject and spread awareness to inform others about the severity of the issue and give other information about the onset and treatment of the disease. It's time to end the stigma.